So our casualty is bleeding profusely from the nasal cavity, and what they're thinking is maybe there's been some damage to the paranasal sinuses, or maybe due to blood in the orbit, the blood's actually draining via the nasolacrimal duct and ending up in the nasal cavity. We don't know what the problem is just yet. And it's actually quite hard to track down, and problems with the sinuses are notoriously difficult to track down, and that's one of the reasons why sinuses are so commonly imaged, especially for persistent congestion or inflammation. And so there are, in this lecture, paranasal sinuses, and we're going to look at a friend as well. And the paranasal sinuses are, as the prefix para would suggest, the sinuses beside the nasal cavity. And friend. Right, let's look at the frontal bone. The frontal bone you can see here on this medial view contains the frontal sinus. So there will be usually a left and right frontal sinus, and this is very unique in individuals, and you can see the frontal sinus here. Okay, this is unique because sometimes, and you'll see this on imaging, sometimes one side is absent and there's no sinus. Sometimes one side is larger than the other, or of a different shape to the other. Sometimes there's no frontal sinus whatsoever that you can see there. And in fact, it's so unique in individuals that one of the staff anatomists in biomedical sciences is actually looking at the volumetric properties of the frontal sinus. And because they're so unique to individuals, they're almost like a fingerprint. So he's looking at the relevance of the frontal sinus towards forensic medicine in identification. Here's the maxillary air sinus, and you can see that the maxillary sinuses are actually continuous with the nasal cavity via the middle meatus that you can see here. You can see this on imaging on the right hand side just here. So here's the maxillary air sinus there. Here are the ethmoid air cells. Again, this is continuous with the nasal cavity, and this is termed the ethmoid sinus. And this is only in the superior part of the ethmoid bone. And so if you have a look at the top-down aspect of the ethmoid bone, centrally you'll see the cribriform plate, and laterally you'll see some of these ethmoid air cells. Now the sphenoid sinus is within the body of the sphenoid that you can see here, so inferior to the hypophyseal fossa and posterior to the perpendicular plate of the ethmoid and the vomer. Now sphenoid sinus, like the frontal sinus, is again quite unique. Sometimes the left and right sides can be septated, sometimes they can be joined, sometimes one side's absent, so it's quite variable. Now the mastoid air cells are within the mastoid process here, and they are not a paranasal sinus, but they're put here for the sake of convenience. The mastoid, you can see that here, not a paranasal sinus. The mastoid air cells are continuous with the middle ear here via the mastoid antrum. And so this has relevance, and this can be imaged, these mastoid air cells. They come up very nicely on skull imaging and lateral cervical imaging as well. And the reason that these are relevant is that, especially in young children, middle ear infections, which are extremely common, the infection can actually pass through the mastoid antrum and into the mastoid air cells. And this results in mastoiditis, which is an incredibly painful condition and usually needs to be seen to medically quite promptly indeed. So how do these look on imaging? Well, we can see that in pink here's the frontal sinus, left and right respectively. Here, and this is superimposed on the ethmoid sinus, is the sphenoidal sinus. If you look at these two areas here, we have the left and the right ethmoid air cells, or ethmoid sinuses respectively. Here we have the maxillary sinus, and posteriorly what you can see here on the right side and here on the patient's left side are the rather large mastoid air cells. And if we look at a lateral skull image, what we can see here is, again, those are visible, except we get much more of an idea about the depth of these sinuses because they're not superimposed on each other. So again, we can see the frontal sinuses here superimposed on each other, ethmoid sinuses, maxillary sinuses, just there, sphenoidal sinus, and finally we can see, and I'm sorry I had to add this in so it's perhaps not as pretty as the other ones, and these are the mastoid air cells. So you can see that they are going to actually overlie the atlanto-occipital joint here. So that's the mastoid air cells.